Good morning, my dear students. I, Bhalsing Mahesh, Principal of Pravara Medical Trust, College of Pharmacy, Shevgaon, welcomes you all for this third lecture on topic Communicable and Non-Communicable Diseases of Subject Health Education and Community Pharmacy for first year Diploma Pharmacy students. So, my dear students, in earlier lecture we had studied the various communicable and non-communicable diseases, and we had studied the basic difference between communicable and non-communicable disease, and also we had studied the three diseases, which includes tuberculosis, then influenza, and chicken pox. It includes the various causative organism or causative agent for, or which we can say disease causing agent, then signs and symptoms, treatment and prevention measures to prevent that disease. In today's lecture, we are going to study another three different or another some communicable diseases. So let's start with first disease, that is whooping cough. It is also called as pertussis. Whooping cough is also renamed or also called pertussis because the due to this name arises from the causative agent. It is an highly infectious disease of respiratory tract. Occur in all ages, the people of all ages, and occasionally after age of 10 years, means generally children are less susceptible for this disease. The children's more having age more than 10 years are more susceptible, and children and adults for this disease mostly occur in unimmunized children under the age of 5. For this whooping cough, the vaccine is there, and those children who do not take the vaccine, or the children which are unimmunized, they may suffer from this disease. The incubation period for this disease is about 7 to 14 days. Now we will see the causative organism for this disease. The causative organism for pertussis or whooping cough is Bordetella pertussis. The mode of transmission, or the way or manner in which this disease transferred from one person to another, is include the droplet infection and articles which are freshly infected by the discharge. Here please read it as a whooping club. The how to prevent this whooping cough, and what are the control and treatment measures for this whooping cough. The this whooping cough can be prevented by immunization of children with DPT vaccine. DPT means diphtheria, pertussis, and tetanus. This is the combined vaccine, which is called as the DPT vaccine, and it gives the protection to the children against diphtheria, pertussis, and tetanus. Understand? So when the children got immunization with this kind of vaccine, they are less susceptible for this disease. Then patient put to bed in well ventilated room. The patient who is suffering from this whooping cough, he should be put in a bed where the good ventilation is there, and discharges from the patient nose and throat should be collected properly on paper and disinfected, and the treatment given with a drug, that is the erythromycin. Then next disease is the mealeases. Mealeases is also called as the rubella. Occur in children of age 3 to 5 year. It is having the incubation period of about 8 to 14 days. Rubella is occur or caused due to the virus and that virus is called as the rubella virus. This rubella is mainly spread, sorry, mealeases is mainly spread through the droplet infection and through the direct contact. As these diseases, that is mealeases, tuberculosis, chickenpox, these all fall under the category respiratory tract infection. So the chances of transmission of these diseases from one person to another person, including the main source, including the droplet, understand, and kindly remember that the signs and symptoms of mealeases include, in earlier stage or in stage 1, which is also referred as catrial stage, it includes fever म्हणजे temperature, then runny nose, cough, appearance of a red spot on mouth, and watering of eyes. These are the all signs and symptoms of stage 1 mealeases. In stage 2 or stage of eruption, a red rash seen at the back of ears and foreheads along with the hairline. Rash spread all over the body. In initial stage, rash only spread or appear on the mouth, but in lateral stage, rash spread all over the body. Then how to prevent this mealeases? Mealeases can be prevented by active immunization. By the two methods are there. One is the active immunization and second one is the passive immunization. In active immunization, live attenuated mealeases virus over 1 year of age children given to the children's, and in passive immunization, human normal immunoglobulin is given to the children or patient. Control, this mealeases can be prevented with the isolation of a patient for 7 days after onset of rashes. Then immunization of contact. Those people who came in contact of a victim or a patient, they should be immunized, and articles should be properly disinfected. The articles or the things which are used by the patient, that things or articles should be immunized, including the bed sheet, then blanket, dishes, plates. This should be properly disinfected. This is the control measure for the mealeases. Then next diseases, the now these mealeases, chickenpox, tuberculosis, then whooping cough, influenza. These all are the respiratory tract infection. Now we will see the arthropod-borne diseases. It including the major three diseases. One is the malaria, second is the plague, third one is the filariasis. Malaria. It is a common disease, and you know that it occur in most tropical region. It is a protozoal disease. It is onset of this disease occur due to the protozoa. It is transmitted from the bite of Anopheles mosquito. Generally, the mosquito is only vector for this transmission of disease. The incubation of the period of this malaria is generally about 9 to 30 days. The causative organism for malaria including Plasmodium vivax, Plasmodium ovale, Plasmodium malariae, Plasmodium falciparum. These are the four causative agent for the malaria, and these all are the protozoa. Then mode of transmission, how this malaria is transmitted. Malaria is mainly spread by vector transmission. You know that who are the vectors then? Mosquito are the vector who carries the protozoa. The bite of female Anopheles mosquito, through the bite of female Anopheles mosquito, and indirect transmission by injection of infected blood or plasma. The when the patient who is suffering from the malaria and the blood of that patient come in contact with the normal healthy person blood, that time The infection may be transmitted from the through the blood or plasma. Congestional, it is due to occur due to the infected mother to newborn baby. If mother is suffering or pregnant woman is suffering, and after that from this malaria, and after that when she give the birth to the children, that newborn baby also also suffer from this disease. This is about the mode of transmission of the malaria. Then how to identify the malaria? It is having some signs and symptoms. Typical signs and symptoms: first, onset of fever with chills and sensation of extreme cold. त्याच्यामध्ये काय होतं, जे सायन्स अँड सिम्पटम्स असतात मलेरियाचे, सगळ्यात सुरुवातीला ऑनसेट ऑफ फिवर, म्हणजे टेम्परेचर येतं विथ चिल्स, थंडी वाजून, थंडी ताप ज्याला आपण म्हणतो, आणि परत खूप जोराची थंडी वाजते. इन हॉट स्टेज टेम्परेचर रायझेस अप टू 106 डिग्री सेंटीग्रेड, which also include the intense headache. Sweating stage, fevers decreases with sweating. ह्या थर्ड स्टेजमध्ये काय होतं, फिवर हळूहळू टेम्परेचर जे असतं ते कमी कमी होतं आणि त्याचबरोबर पेशंटला घाम येतो. देन हाऊ टू प्रिव्हेंट दिस मलेरिया? Prevention of the malaria. By prevention against the mosquito bite, we can avoid or prevent the malaria. If आता आपल्याला माहिती की मलेरिया कशापासून ट्रान्सपोर्ट होतो, फ्रॉम द बाईट ऑफ ॲनाफायलस मस्किटो. मग आपण मस्किटोची बाईटच आपल्याला होऊन नाही दिली तर आपण हा डिसीज काय करू शकतो, प्रिव्हेंट करू शकतो. देन बाय अडॉप्टिंग अँटीलावरल मेजर्स. अँटीलावरल मेजर्स म्हणजे काय, जे आपल्याला माहिती आहे डास असतात, डासाची उत्पत्ती कशी होते, पाण्यामध्ये होते, खराब पाण्यात. काही काही जो डेंग्यूचा डास असतो तो जनरली त्याची अंडी शुद्ध चांगल्या पाण्यात घालत असतो. मग त्याची पाण्यात ज्यावेळेस मॉस्किटोची निर्मिती होते त्याच्या अगोदर त्याची जी स्टेज आहे दॅट इज द लावरल स्टेज. त्या स्टेजमध्येच आपण काय करू शकतो, त्या स्टेजमध्येच त्या डासाची पैदास आपण काय करू शकतो, थांबवू शकतो. कशी? मग त्यासाठी वेगवेगळे मेजर्स आहेत. आपण मासे टाकू शकतो पाण्यात, गप्पी माशासारखे, जे त्या लार्वाला काय करतील, किल करतील आणि डासाची उत्पत्तीच होणार नाही, किंवा आपण लार्वाच डासाचा तयार होणार नाही याची काळजी घेतली की आपल्याला बरोबर हा डिसीज प्रिव्हेंट करता येतो. देन अँटी अडल्ट मॉस्किटो मेजर्स. देन नेक्स्ट, कंट्रोल ऑफ ह्युमन रिझर्वायर. These are the some preventive measures for the malaria. Now next, earthborne disease including the plague. आता हा पुढचा डिसीज आहे प्लेग. इट इज अ झुनोटिक or zoonosis disease that is infection transmitted to man by infected rat fleas. आता आपण हा एक प्लेग नावाचा डिसीज आहे, जनरली ह्युमनला होतो. कशापासून होतो, तर जे उंदीर असतात त्या उंदराच्या बॉडी सरफेसवर काय असतात, प्लिया, किंवा आपण ज्याला आपण म्हणतो एक प्रकारचं इट इज इन्क्लुडिंग फ्लीज, किंवा माशीसारखं एक छोट्या प्रकारचं एक इन्फेक्शन कॉझिंग एजंट असतो, आणि विच इज ट्रान्समिटेड ओवर बाय द रॅट. म्हणजे रॅट झाला व्हेक्टर. रॅटमुळं होतो का, ॲक्च्युली नाही होत. तो रॅटच्या बॉडी सरफेसवर जगणारा एक घटक आहे ज्याच्यामुळं आपल्याला ह्युमनला प्लेग होतो. द इन्क्युबेशन पिरियड इज अबाउट 9 to 30 days. आणि मग याचा जो पॉझिटिव्ह ऑर्गॅनिझम आहे त्या प्लिया इज ऑल्सो कॉल्ड ॲज द यार्सिनिया पेस्टिस. Now, what are the signs and symptoms of plague? It including the systematic signs, including the fear, then central signs, which including the headache, respiratory signs, including the cough, hemophytis, dyspnea, chest pain, and muscular signs including the weakness. These are the various signs and symptoms of the plague. How this plague is transmitted? Firstly, this rat carries plague bacteria over it, on the surface of it. Then flea drinks rat blood, or this bacteria drink the बॅक्टेरिया काय करतो, स्वतःची ग्रोथ कशी करतो, बाय ड्रिंकिंग द ब्लड ऑफ दिस रॅट. देन बॅक्टेरिया मल्टिप्लाय इन फ्लियाज ॲबडॉमिन, आणि ह्या माशीच्या आतमध्ये त्या बॅक्टेरियाचं काय होतं, मल्टिप्लिकेशन होईल. ज्यावेळेस ही माशी ह्युमनला बाईट करते, when this flea bite to the human, that time human got infected. Means this rat is only the vector, main causative organ is the flea, and inside fleas there are certain bacteria are present. When this flea bite to human, that time this human got infected. Understand? Now how to prevent this प्लेग. आपण प्लेग कसा प्रिव्हेंट करू शकतो, प्रोफायलॅक्सिस फॉर प्रिव्हेन्शन ऑफ बाईट्स ऑफ फ्लिया. आपण काय करू शकतो, काळजी घेऊ शकतो, जी फ्लियाची बाईट आहे ती आपण प्रिव्हेंट करू. कशी, बाय कंट्रोलिंग द रॅट. कारण आपल्याला माहिती की ती फ्लिया कुठं राहते, रॅटच्या बॉडी सरफेसवर. मग बाय कंट्रोलिंग द रॅट वी कॅन प्रिव्हेंट द प्लेग. अर्ली डायग्नोसिस, notification and isolation and disinfection of the exertion लाईक स्पुटम. याच्यापासून आपण अर्ली स्टेजमध्ये डायग्नोसिस निदान करून, नोटिफिकेशन करून, पेशंटचं आयसोलेशन करून आपण हे सगळं प्रिव्हेंट करू शकतो. देन द अटेंडंट हु इज अटेंडिंग दॅट पेशंट or he should must wear protective measures like gloves. These are the some prevention measure which are including, these are the general measures. Then some key chemoprophylaxis measures which including the protection using suitable drugs. Then third measure is the vaccination. Two vaccines are used, one is the kill vaccine and second one is the live attenuated vaccine. The next disease is the filariasis. Filariasis filariasis is a group of disease caused by nematodes. Filariasis, this filariasis caused to man by blood sucking arthropods. The incubation period for this filariasis is not less than 3 months. Here you can clearly observe the symptoms of filariasis. This is the healthy leg of human, and this is the leg of a human who is suffering from the filariasis, ज्याला आपण म्हणतो हत्तीपाय रोग, ज्याच्यामध्ये काय होतं, स्वेलिंग ऑफ लेग्स. देन causative organism of the filariasis include these 4 types of bacteria. The next mode of transmission, this infection is transmitted by the bites of infected mosquito. Then how to prevent this filariasis, we can certainly reduce the mosquitoes by eliminating their breeding place, by killing the larvae by larvicide, for example kerosene, by using mosquito net to prevent the bite of mosquito. Then there are another measures to prevent personal protection, including wear protective clothing, use insect repellents. Then common treatment including the whole population by diethyl carbamazepine citrate. This is the some treatment measure. Now in today's lecture we have studied the another arthropod diseases and some remaining respiratory tract infection. In next lecture we will continue with the next part of this chapter. Till then, study at home, stay safe, stay healthy. Thank you.